Hi guys, welcome to Jane Level Wellness, and thank you those who have subscribed to my YouTube channel. I appreciate for your support. Those who have not subscribed, kindly subscribe and press the notification bell. Yes guys, today we are discussing about bipolar. Bipolar is a disease or mental health disease that is normally mistaken with depression or mistaken with other illnesses or mistaken with somebody being notorious. So, what is this bipolar? I may not go so much deep, but we may discuss some few tips that can help us know what is so disease is all about. Bipolar, we have bipolar type 1, bipolar type 2. But generally, today we are talking about two types of bipolar, or bipolar having manic bipolar and depressive bipolar. So, what is manic bipolar, or how can you know that somebody has this manic bipolar? Manic bipolar, it is characterized by somebody experiencing a lot of energy or having episode of very high mood. It is also associated with having elevated energy or power. Actually, right, if somebody is working in the office and you may be having this type of a disease, you may feel as if you have so much powers such that you don't need other people in that office, that you can do every job that is assigned in that office because you feel a lot of power within you. It is also associated when because of that high mood, because we are talking of high moods and low moods. When the bipolar is high, that is a manic episode. Somebody can be having episode of talking very fast or excessive talk. Somebody might be just talking normally, but you must start experiencing talking a lot, and somebody is not drunk, somebody is not in sort of sane, but somebody start talking a lot or talking very fast. They can also have some abnormal negative behavior, like maybe behaving in a certain way that is not acceptable or expected by the society. You can then start removing or changing clothes where people are watching, or not being sensitive to people's feelings without actually caring some of the things or actions one may have. They may have a excessive or extra energy such that they can work extra, or they may have no time to rest. Some will just be mobile or just always doing something, not like resting, not like sitting. Some just like, because of a lot of power that is elevated within self, some just feel like moving forward or just doing something instead of inactivity. The opposite of manic bipolar is depressive bipolar. Actually, this is the most dangerous one. Why are we saying it is dangerous? Because somebody experienced very low moods. Remember, the other one is high moods, where somebody is very, very, very active, very talkative, very socializing. But at this time, the person becomes like he or she are shut down. He is experiencing low moods where the person is not able to interact with other people. The person become more quiet. The person lack energy. The person feel not like working or doing something, and that person is experiencing very negative emotions within self that even are preventing that person to reach to the other people. Most of the time, that is the time many people experience thought of suicide, and they feel like killing themselves or harming other people. Because of that hormones, this person can easily kill himself, because remember, this person is not talking. The other time he or she was very talkative, but all of a sudden not talking. So this is a dangerous time, or a person to watch at this time, because if you don't reach out to that person, they can kill themselves when they are in low moods. So what are the causes of bipolar? Bipolar is caused by heredity, like just depression. It can be passed from one generation to another, from one person to another. It can also be caused, as we see in the depression, the chemical imbalances in the brain. It can also be caused by environmental factors, especially the factors that are not favorable. And it is also triggered when these events are very negative, or during the stressful time or stressful events. How is bipolar treated? Like depression, bipolar is treated with psychiatric drugs. It is managed in combination with drugs and psychotherapy, and also social support from the family members. Early diagnosis works better for bipolar. Remember, we may have many people having this disease, but you never think it is bipolar, because especially when the person is very active, you think the person is working hard because want to achieve, but you don't know it is the disease. When the person is experiencing low mood, may not able to give good production, and many people are sacked from their jobs because when they're experiencing this episode, or when they fail to perform well in schools of learning. So remember to watch our neighbors, to identify when they are having these disorders that are confused just with a normal person, but just let you know that it is a disease that need to be diagnosed, to be treated, to be managed. Thank you guys for watching my videos and this video. Those who have not subscribed, kindly subscribe and press the notification bell to be notified when I post new videos.